keep rolling up away from me onto your left side, okay? All right. Now, she's on her left side. Her left side is touching. I realize this is the right side of the patient, okay? That's up here. I'll explain here in just a second. Marker placement, because she's in a left lateral, what marker do you think we're gonna put here?
Left.
Correct. I have a lot of students who like to put the right marker because it's technically the right side, but that's not what we're imaging, okay? No different than when we're doing a lateral T-spine. The left side's touching, so that's why we make a left lateral, we make it the left. Same thing with C-spine, it's the left, okay? All right, so she's like this, I'm gonna give you a hug, I'm gonna reach up here, I'm gonna line her shoulders up. If she needs to double her pillow up, she can. You want me to double your pillow?
Yeah.
So ask them that, that's super helpful. So again, you wanna make sure, I'm mainly looking at this shoulder being in the same plane. So I wanna make sure my hand is completely straight down her spine. Now she does have a little bit of an angle. I'm gonna pull your shirt a little bit. Her spine dips a little bit. We have, you can actually use this one. There is a little triangle sponge in the back. You can just take it like this and raise your set up a little bit. Pop that in there. That actually, everybody's like, it's just a sponge. Really, that little bit of sponge, believe it or not, really does help. It really does. It'll be a little uncomfortable for your patient. You wouldn't think because it's squishy, but it can be uncomfortable. All right, so this one, we're at the crest, okay? And this is easier when they're on their side. I can find that crest really easy. Even on large patients, because the belly is gonna fall forward. Everything pulls forward. Like, dang, this actually gonna work. Okay, so find here. Okay, so now I'm actually right on her mid-coronal. Remember what I said, we gotta come slightly posterior, okay? Because her spine's here. You're gonna end up with a little bit of light on your table, and I leave my collimation at 10. I haven't changed in my collimation from the 10 when I started from my AP to my obliques to my lateral, okay? Still using my 14, okay? So from here, I'm gonna go anywhere, you can usually go anywhere 1 inch to 2 inches, but I usually pop my knuckle right there, go about my knuckle, end up with a little light on the table, okay? This is where your lead blocker, okay? Lead blocker, just take it to right at the edge of the light field.
Does that have a right side? Is it like
It's honestly, nope, as long as it's the same, either whether I put it, yeah, it's the same either way.
Okay.
But good question. All right, so I'm right here at her crest. And again, spine's right here. I have a little extra light. If I want to, I can technically go in to about there, but I'll just still leave it at 10. I'm not worried about that. So I can go here. Now you will have patients. This is not going to be with every patient. Okay, so again, I put my hand on her. I can see I'm in a good lateral because my hand is straight up and down. Okay, whether you pop your marker here on her hip is fine. If you have enough light here, you are allowed to do this, okay? And this is not gonna be with every patient. So again, safe bet here. And actually, I am a little too far posterior, so hold on 1 second. There we go, a little too far. Okay, because again, this central ray is essentially going straight through the bodies. Okay, that's why when they tell you to line up mid-coronal and come back slightly posterior, that's what they're wanting you to hit, is the vertebral bodies themselves, so that way they're right in the center of your image. Pop your lead blocker right here. I have my left marker because it's her left side that's down, okay? Left marker right there. This will be for, and if I need to, do you need anything between your legs, Natalie? Okay. If your patient does, you can give them this sponge, tell her to, you know, if she needs it, that's fine. If not, then don't worry about it. But you will have some patients that, can you put like a pillow or something? Sure. It really does actually help, and it actually helps line them up a little bit more too. Okay. All right.